And a major challenge is how to build trust among the public going forward for healthcare, in our hospitals, clinics, through messaging, and of course, digitally. And to take that question, we have our moderator for the next panel. She's my colleague at Boom Live, Tanvi Shukla. She's the consulting editor, and she does a show called Simplified. Tanvi, it's over to you.
Thanks so much for that, Venkatesh. And I think actually that was a perfect segue to the next conversation that's lined up. Thank you to all the panelists who joined us for the last conversation. Extremely insightful. I think I agree with Dr. Nair when it comes to availability of data and how to look at data and where to find the right data. That conversation could have gone on for a longer time for sure. But let me say good afternoon to everyone who's joining us right now for this panel now. Building user trust and in digital and in public healthcare. Now, forging public trust really is integral, obviously, to developing and maintaining the health and well-being of healthcare stakeholders, be it individuals or communities or society in general. Hence, it is the need of the hour for healthcare practitioners and policymakers to instill the notion of public trust to improve the public's health and strengthen engagement dynamics between the public and, of course, the public health system. The panel discussion today that we're going to have will strive to take this conversation forward by addressing and highlighting the ways in which this public trust gap between the community stakeholders and the healthcare industry could actually be bridged, particularly in digital and public healthcare. So I'm not going to waste any time. Let's straight away welcome our three speakers this afternoon. We have with us Dr. Mohit Mathur, who is currently heading the Department of Critical Care Medicine at Max Healthcare with more than 15 years of experience. Dr. Mohit is also a member of the Indian Society of Critical Care Medicine, European Society of Critical Care Medicine, and the Indian Society of Anesthesiologists. Dr. Mohit was the recipient of the Sushruta Award for Clinical Excellence at the annual Max Healthcare Awards in 2021. Our next panelist is Dr. Kumar KV, who is a senior technology and security leader with over 20 years of proven experience in digital strategy, in innovation, systems designs and development, along with planning, budgeting, enterprise architecture, information security, and of course, privacy. He's currently the group head of information technology at Narayan Health in Bengaluru, where he is leading a high-performance team comprising 200 associates across the organization's software development center and the IT operations department. And our third speaker is Dr. Banali Das. She currently helms the role of a consultant in lab medicine at the Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute with over 16 years of practice experience. Dr. Banali Das is the technical committee member in the International Federation of Clinical Chemistry and Laboratory Medicines, 6-member committee on standardization of thyroid function tests worldwide, and the corresponding member of the IFCC Committee for Reference Interval and Decision Limit. She's the only Asian member in the IFCC, the CSTFT that I just mentioned. She's also the Joint Secretary of the Consortium of Accredited Healthcare Organizations. Big hello to all of you, and of course, to all our other participants in this conversation. Let me just start off with a very basic question to set the ball rolling. What do you see as the biggest challenge in building user trust in digital and public healthcare? I mean, I, as a layman, as a non-healthcare stakeholder, would personally observe that rapidly evolving concepts for a novel coronavirus actually led to a lot of doubts within the minds of people, a lot of questioning about what's going on. I always found it extremely tricky to explain to people as to why mask had been necessary and mandatory all this while, and why it's not important anymore, or why it may again become the most important thing a few weeks from here on, or why a vaccine, the gap between 2 doses should be 1 month, or suddenly now it's 3 months, and so on and so forth. You get the gist of it. So essentially what I'm trying to say is these evolving concepts, as we got to know a lot more about the virus, also meant change in how we were tackling it. That did bring about a lot of confusion and doubt and lack of trust. But that's my view as a layman. I'm going to hand it over to the experts really to share their views. But Dr. Banali Das, would you like to take up this? What, according to you, is the biggest challenge when it comes to building trust?
Thank you for the organizers for inviting me. And yes, the roadmap for healthcare, like involving strategies for harmonizing, communicating, and integrating with all the stakeholders. So the gap is between all the stakeholders, like the communication between the clinicians, diagnosticians, then the IT sectors, like where we know the big data and the digitization or digitalization. So the gap between the communication gap between all stakeholders, or harmonizing and communicating and integrating all the stakeholders or the industry in order to formulate the guidelines for assisting correct measurement, diagnosis, and management of diseases, and reduce the cost burden, and while maintaining the quality and patient safety. So I find this is the major gap, like where we are not communicating from each and every, we are working in silos. So recently we started some project with Digital Health Department of IIT. So I realized many of the things like implementation, how we can implement artificial intelligence or cloud computing or machine learning in our day-to-day practice, like reporting the acute kidney alert. This is or electronic health record. So sometime the cardiovascular disease, AI cardiovascular disease risk stratification. So we can actually implement many things in our day-to-day practice, but because we don't we work in silos and we don't communicate, so because of that we face a lot of challenges both in the public sector and as well as in the private sector.
Okay, interesting. And I do want to just very quickly follow up with you on why do you think that lack of trust or the trust gap really exists? Is it simply because each of the stakeholders are working in their own silos, or is there more to this?
There are more to it, because one thing is, of course, we clinicians or diagnosticians, we have a lot of technological gap or to understand the process, but COVID has done has given the quantum leap in understanding. Like 2 years back, when I used to not understand how to integrate my process with the patient, how it is very much important to integrate different centers, even for sitting here, I may monitor many of the lab reports from different centers or different resource poor setting. I can help or integrate the inventory management, like we realized during the second wave, how for each and every resource we have struggled. So I felt that the gap here is in India, that the digitization or digitalization, we are everything like vaccine monitoring. I think last panel, Dr. Tanu and everyone spoke about the vaccination hesitation. And because of that, many of the monitoring or even the lab reporting of our RT-PCR reports, many times we don't, or rapid antigen reports, many times there is a gap between reporting. So I feel there is more to it rather than the communication or harmonization. So I think we need to integrate between clinicians, diagnosticians, and all stakeholders, media, everyone. We need to play a very important and significant role, like how IoT, AI, and digitization and building the trust to patients or patient safety is patient empathy. I believe this is the most important criteria for anyone working in the healthcare sector, either private or public.
Okay, Dr. Kumar, do you agree that perhaps the biggest challenge is the lack of trust between the various shareholders and entities themselves within the sector? Only if you come together and are able to use technology better, will you actually be able to bridge the gap with the public as well?
Yeah. Thanks, Tanvi. And first correction is I'm not a doctor. I'm a pure technologist.
Apologies.
See, I think in my opinion, the lack of trust, basically stems from the fact that in the last 2 years, what we have actually seen is One is the lack of verified sources of reporting, right? Because many of the information what causes misinformation or disinformation, because what we are in this digital decade, what humans are actually facing is basically an information war or an information overload, right? Which happens through various social media channels. So lack of verified sources through which people can understand and digest the information and then spread the good word, right? So there is a lot of conflicting information that is actually out there through all these channels. Then because India, as a country, from a public health standpoint, from a digital health standpoint, we haven't made the right investments in the health infrastructure, which meant that everything was actually in paper and there were no digital health repositories available for which we can get back and understand how the data is actually collected, and which could have given us a ton of insights, which would have enabled us to communicate better, to the layman who's actually out there so that he or she can understand that and take appropriate action, whether be it masking, the COVID-19 is just an example. I'm sure that more such outbreaks will actually happen in the years to come. And lack of scientific evidence, because they said wear a mask, 2 gaj ki duri, wash hands, and then they, and then there were, and even Dr. Tanvi had actually highlighted in the previous panel that lack of protocol standardization itself caused a lot of issues, whether what to administer, when to administer, and they had to roll back a number of protocols. Most importantly, lack of trust also stems from the fact that there is lack of engaging with proper leaders. See, in a country like India, it is a multicultural, diverse society where there are billion people that are actually there. It is not just the political system actually trying to engage and conveying that meaning of trust. You require a very multimodal, multicultural, diverse people to come and reinforce the message to people, which means that engagement through community leaders, engagement by big shots or big medical doctors, medical professionals, through sports people, right, through various mechanisms. If the message could have been percolated much better, then it has a better reach. Believe me, all we are seeing is we are all in urban areas and we are seeing all this information, but there are people who don't have access, who are at that last mile of the healthcare delivery that we actually call. How do they actually hear the messages? Because what we see in urban is we have a mask, we put that N95, but the people who are there in the last mile, they have not even heard about a mask, right? They would have had a piece of cloth which they would have folded and gone, that has been there for several hundred years. So I think lack of engaging appropriate people who are for that appropriate community and getting that message in the way in which they would be able to understand has resulted in this trust deficit is what is my opinion.
Okay, lack of communication to people who need to know the last mile communication strategy as well, extremely important. I think we, when our vaccination campaign started, even though everybody told us at that time that, India has already an exhaustive, very large setup, mass immunization is set up and we will not have problems. We did encounter problems because now we were looking at vaccinating adults. And that was not something that, especially in the rural areas, it was extremely difficult to convince the adults to come and get the jab. We did see a lot of innovative, communication strategies being deployed there by the local administration to try and reach out to the people. So maybe if you expand that and say we need to do it at a larger level, constantly about all the evolving healthcare policies and treatments and technologies, then that would make it easier. And I'm going to now split it into various kind of deficits that exist. For example, Mr. Kumar, let me ask you this. There is lack of trust in doctors. There is lack of trust in medicines and treatments. There's lack of trust in newer vaccines that are coming about. And then there is lack of trust in technology. Let's talk about medicines. That was something that also came up in the last conversation. Dr. Tanu Singhal was speaking about it, saying, in between all of these new drugs came in, there was so much of conversation about remdesivir, became the most sought after drug, to a point now that we're being told it does nothing for you, actually, unless you are at a critical position. So how do you build that trust where people believe that the drugs they are being asked to take are actually good for them and beneficial?
Though I'm not a doctor, I can, I can only talk from a technology standpoint. I think the availability of scientific evidence, with regard to any medication has to be there. And, if that medication or if that course of treatment has been, given to a larger course of, or larger cohort of people, which did not have any sort of bias, right? Because what would have worked for a certain demography of people need not actually work, for another demography of people, because the genetic structure, or there are various changes that are actually there. So, in my opinion, because of the lack of scientific evidence, that people basically lost in, trust in that from a medication standpoint. But if that would have actually been available, we would have been able to bridge that gap.
So, Tanvi, I am a bit of an optimistic person. So whatever happened, we are all free to criticize, and we all have our reasons to criticize whatever happened and how we dealt the situation. But I will give you the perspective of physicians who were in the middle of that crisis, who were right in the middle of that battle. And we felt that we means the whole country, the people, the physicians, the private healthcare, the government healthcare, we came along very well, and we dealt with this situation in a very well structured way. There can be criticisms, but with the limited resources that we had at the beginning of this thing, and as you are rightly saying, the data problem, still we managed in the end to manage this situation very, very well. Both the main problem of COVID-induced admissions and the vaccination also. Why I'm saying this is, we used to look up to West prior to this particular COVID for all the literature. Our own study publications are very, very deficient. And during this epidemic, we found out that we cannot no longer rely on West for that guidance. Like suppose you're talking about remdesivir. Remdesivir, WHO told us in the middle of the second COVID wave, that remdesivir is not useful. And our own experience till that point of time was that remdesivir is useful, but if given early in the illness. Now, remdesivir is an antiviral drug, and common sense tells her that antiviral will be effective in the first 7 days of illness when the virus is replicating in the body. No point giving it beyond that phase when the patient has moved from the viral illness phase to the inflammatory phase. But initially, the whole world bodies and the WHO was telling us to give it after 7 days in moderate disease. That means by the time the oxygen requirement had already started. So, and then they later on backtracked and said that it is not useful in that category of patient also. Recently, we get a major trial in NEGM, which is telling us that if used early, remdesivir is a very, very potent drug, and which this particular thing is also supported by our own experience. So whatever we did in that period, we were clueless. We did not get any guidance from any world bodies. WHO was flip-flopping. There was no other world body guiding any of us. Any of us means any of the Western, any of the third world countries. So within the limited resources, with the limited data set we had, we fared really quite well. And the boundaries between the civil healthcare and the private healthcare, all those boundaries melted. And in the end, I think that we came out very well. We could have been fared much worse, but still we managed to come out with flying colors. All those who died, all the mortalities, nobody can deny that did not happen. But still, as compared to many other countries, we fared very, very well.
Okay, now, Dr. Mathur, let me also specify that for not a minute. Am I saying that the lack of trust is because we did a bad job at all? But it's normal human tendency. When you don't understand something, you don't trust it. And when it comes to medicine, not too many of us understand it. Even as you and I, and we're having this conversation, we've opened it up to questions. One of the questions that has come is, why should we be taking a booster dose even after we've seen so many deaths and breakout infections take place? That's what we're trying to reach out to and fix. How do we do that?
So as of now, regarding the booster doses, anybody who had a COVID in the third wave, that is in the month of January, the recommendation is to wait for 6 months at least, because already enough antibodies are there in the body and we don't require any further jab or booster. And the other reason against getting a booster is every few months the virus is mutating and it is going into the new variant is coming up. So the older vaccine will not be very effective for the new variant. So I don't think there is any reason to panic and to queue up in front of vaccination centers for a booster as of now. Most of the population, around 60 to 70% of the population, did get the infection in the third wave, and they should not be hurrying to get the booster shots. Booster also has certain side effects, not because of the vaccine per se, but because of the hyperimmune response that the booster can generate in a patient who already had a recent COVID infection. So again, booster should not be, it is not a mandatory thing. We should wait for some more time, at least for next 3 months before taking the booster shots.
Okay. There's been much conversation when it comes to building trust for the drugs that are being used for a treatment. But let's, for a bit, also talk about diagnostics. Dr. Barnali, how do you build trust in a diagnostic system? Again, if you take the example of COVID, every few months there was some change in thought and the process there itself as to how to detect it. So it becomes tricky, doesn't it?
True. Like Dr. Mohit said, here again, the right information at the right time, very important, because we believe right patient, right time, and right diagnosis. So many times what we have seen during the first wave and second wave, that in WhatsApp, people are getting the advice, like this test to be done, and this all the battery of tests they have advice to do for even with 2 days mild fever. So because of that, there is a lack of trust, or sometimes patient deteriorated with because they were doing the monitoring and getting the treatment at home. So this diagnosis, as there is a major change, our RT-PCR is initial period, it was not available in a resource poor setting, or in the in Tripura or Leh, Ladakh. So in that, the rapid antigen test was available. Then ICMR has done a beautiful job. They have actually empowered the diagnostic ecosystem totally, and with the supply chain management from all the IVD sector people. So because of that, there is a right time, right test, and right patient, very important. And also the digitization played a significant role. Like people sitting here and can do the digital monitoring, or sometimes there is a home-based home collection, and also reporting of the RT-PCR. So everything was available, although we know there is a big data, and even there is different model for epidemiological model, and based on those data, garbage in and garbage out. So many times this was those data was not utilized properly, and many times it was not actually there was not a proper representation of the data. We have not got the correct figure, because of many have done a rapid antigen test or RT-PCR. So this, because right information at the right time is very important. So these were the challenges to build the trust with the consumer and build the trust with the patient.
Yeah. So in that sense, then, Mr. Kumar, did the pandemic actually help bridge the gap when it comes to trust in terms of using technology? Are people now less suspicious of using new age technology or getting a remote treatment or remote diagnostic done?
I think the pandemic has helped us to leapfrog in terms of the digital health infrastructure, but the healthcare organizations which are offering digital solutions, they are also trying to find the right fit for clinicians and patients. And many of these trust issues when it comes to technology basically stemmed purely from the fact that because of privacy issues, security issues, poor digital experience. The first experience or the first digital encounter that they actually was very poor, and lack of trust in digital tech companies. Right? And in a recent survey, of local, by local circles, 60% of people wanted to use digital health technologies but are hesitant to share personal details beyond health and medical records, or they want 60% of the people want to create health IDs, the Ayushman Bharat digital health IDs. That's a beautiful thought process which the government actually has to to ensure records are portable. But then the privacy implications of it, who is going to handle my data, who is going to, what sort of information are they going to collect, right? I think those areas need to be addressed, and if that is addressed in a very structured manner, you definitely see that trust getting established and the experience also, or the digital adoption also going up.
Yeah, so let's get a little, let me cite a few examples and then get you back on this conversation. I also have a question from Dr. Fuad Ali, who says, looking back, was the government public health system confidence building measures adequate? You mentioned people's hesitancy. We saw that one of the state governments, I think it was the Kerala state government, right in the beginning, that came out with their own platform where they wanted to collate all the information about patients such that it's easy to track everybody. And no matter where you are, you're able to access those records. Now the government, the central government, also has a similar system in place. But the biggest concern that everybody has, like you said, is privacy and data security, especially when it comes to a public entity running it, not a private entity, but some kind of a government which is in the center of it, controlling all things. Are governments doing enough to allay those concerns?
No, I think the government has taken significant measures. I think the last 2 years, we would definitely say, I think we have to see things from a positive light, like Dr. Mohit was saying. We've learned a lot of lessons. One is the government has, increased the investment in digital health infrastructure, which is a step in the right direction. The establishment of the National Health Authority and the National Digital Health Mission on mission mode is also a step in the right direction. And the entire architecture itself has been planned out in such a way, it's a federated architecture, so that the government doesn't actually hold all the data. They don't have a large holding tank where they're going to collect all this data, basically keep processing that. Maybe that is something which other countries actually doing. In our thing, how data exchange basically happens, it's in a federated way, right? Which means that very similar to what UPI is today is what Health ID is going to be for the the government of India when it actually comes to, or when it comes to India as a country, when it comes to from a health standpoint. So what we are actually having is a completely different process. We are not aping the West in that, especially. So by having a federated architecture, we are ensuring that each person's data is there with that particular provider, and if there is consent that is actually provided, then the data basically get transferred. Now, when will basically the government actually have data? So they also have come out with specific data policies which says that what will they do with the data, and with the upcoming personal data protection bill of which is actually there. I'm very, very sure that we will be able to, the government will be able to have, maybe a de-identified or an anonymized set of health data through which they can, make inference and ensure that appropriate measures are deployed to augment public health wherever required. From that standpoint, I think we are in the right direction. Of course, in a large country like India, it will take time, and it requires multi-party, it will require stakeholders from various agencies to come together to deliver this. So we say that we are in the right direction, and the government is taking all possible steps to address that in terms of budget.
And I think beyond that, when we talk about building trust, yes, go ahead, Dr. Martin.
Yeah, thank you. So I totally agree with Mr. Kumar. In fact, one of the single biggest advantages that has come out of this crisis is that people have started prioritizing health for the first time. And this pandemic has strengthened digital health space. And now is the great time to strengthen the consumer trust in that space. So there is no need to convince anyone right now. People are themselves trying to find out about the best digital health solution out there in the market and trying to embrace it. So we just have to build up on this momentum. We should not let go of this opportunity. And like what happened in March, the previous coronavirus outbreak, the MERS, Middle East Respiratory Syndrome that happened in 2012. Had we learned the lesson then and taken appropriate precautions, we could have avoided this situation. So now is the time that we learn from this, we build on this advantage right now and prevent any such future episode from happening, because there is an Israeli app which layers maps over symptom tracking. People are encouraged to enter their symptoms into the app, and the government layers map over it. So they can pick up early from which particular area people are reporting more symptoms, so they can pinpoint the origin of the outbreak in that area. So we need to utilize this time, this opportunity, so that we utilize this and we prevent any such future outbreaks. Because as per United Nations Environmental Program, every 10 to 15 years now we will have some zoonotic disease outbreak. So this is a norm now that we will have to live with. And we will have to utilize this current experience to make ourselves stronger for a next possible crisis, and we should be able to avoid it. That should be the objective.
Give me an example. Give me an example when you say we need to use this opportunity and capitalize on it. Who is this we, and how well can we do it? One example.
So who we means, I think I will be able to broadly segregate this we into three categories. One is the physician group, the healthcare providers. They, as of now, are not very well acquainted with the digital health tools. So now we will have to brace up ourselves and improve our understanding of these tools, so that then we can communicate to our patients about the useful of this. Second is the urban lot, who are already in a position to embrace this technology for their betterment. The third most important group is the underprivileged, those in the remote areas, those who elderly groups, disabled groups, who deserve the healthcare or contact with healthcare most. So I think that would be the most problematic area. How do we utilize this experience and reach out to that third group who are still not getting the healthcare contact? And with digital healthcare, it is very easy to even involve that group also.
Okay. We're almost out of time. Our next speaker is also here ready. So I'm going to quickly ask Dr. Banali Das to you first, and then to Mr. Kumar to give your closing comments. Go ahead, please.
Yes, like Dr. Mohit said and Mr. Kumar said, this implementation of the digital health, or along with all the stakeholders like clinicians, diagnosticians, and everyone like who is giving the information, like media. So we should communicate and bridge the gap between all of us. And one is the clinical decision support that is actually less utilized, we realized, in both public and private sector. So we take the expert view, like the clinicians. Even the COVID, we have seen a lot of model, SARS model, Sutra model for prediction of the epidemiological trend or prediction of the Omicron waves from the South African incidence and prevalence. So like if we take the expert view, if we take the view from all the stakeholders, and if we can build clinical decision support in our open digital healthcare ecosystem, that's very important to make it open rather than working in silos. I may be doing some work, or you may be doing some work, Mr. Kumar may be doing excellent work in his this thing, but this is not open to everyone. So I think the digital health mission of ours to work towards this open digital health care, I think this is the roadmap ahead.
Well, on our part, I can say that we would definitely love to have a lot more of these conversations, and get the ball rolling from our end at Boom. Mr. Kumar, would you like to add anything?
Yeah, so I think in healthcare delivery, there are many digital processes which are operating beyond what the customer sees. So every process that we build, a layer of transparency needs to be embedded whenever it actually comes to sensitive health data. Organizations that monitor and report on digital trust with real-time accountability will be the new normal for value creation in digital era, where personal health record information is a valuable commodity. Believe me, a healthcare record costs $369 when compared to a regular record, if somebody hacks a personal health record. So as users get, or as public gets more informed, managing data and protecting the privacy of the data will be an important barometer of how healthcare enterprises will be trusted by their wider stakeholders. So that is my 4 points on on.
Well, that was a brilliant way to actually summarize this. So we've got transparency, accountability, credibility of the institutions and the data that is available, that is being used, and of course, communication, really to take it out there to the public. These are the few things that need to be focused on when you build further on trust and public trust. And like Dr. Mathur said, now is the best time to do that, as we've already got the people's attention because of this pandemic. Let's build on that. With that, thank you so much to all of our panelists for joining it.